care is specialized medical care that focuses on patients and their families and addresses suffering. Whether it's physical, emotional, psychological, or spiritual, palliative care is a team of experts, typically a physician, nurse, social worker, and chaplain, that are focused on the patient and the family to improve quality of life and help patients in any supportive way possible. So palliative care is seeing patients with very serious illness, often cancer, but also very advanced lung disease, advanced kidney and liver disease, patients with advanced neurological diseases. Often patients are dealing with life-limiting or life-threatening conditions, but while some patients may go on to ultimately transition to hospice care, some patients graduate from our program and can go back to follow up with their primary care. We invite patients and their families to come because palliative care is also based on the family in addition to the patient. So we encourage folks to come, and usually we talk about symptoms, so it's delving into those very serious symptoms that are causing people to have poor quality of life, like pain, nausea, trouble with bowels, anxiety, depressed mood, fatigue, appetite problems. So we spend a lot of time talking about symptoms, and often it's time given to that discussion that maybe they aren't spending with their other doctors because they're focused more on their treatments for those appointments. So it's a very in-depth conversation about symptoms. In addition to that, we're talking about just the emotional and psychological toll that this takes on patients and families. You know, when you go through a serious disease like cancer, it affects all parts of your life, and we understand it's not just physical, but it is very emotional, sometimes psychological, and spiritual. Care is specialized care that can be offered to patients at any age and at any stage of disease. So palliative care can be started right at the time of diagnosis. Hospice care is specialized care for folks who are nearing the end of life, typically within the last 6 months of life. So palliative care can be delivered right alongside concurrent care. Patients can be seeing their oncologist and taking active cancer treatments, still receiving what we would consider aggressive care, whereas hospice care is typically for patients who no longer want to go to the hospital, no longer are benefiting from aggressive treatments. I think a lot of patients come to their initial visit very fearful and very anxious. Maybe they think they've been sent to a hospice appointment, and that's just not the case. You know, we try to really keep things very light, very non-threatening. We're not here to hurt anyone, we're here to help. And I think once patients realize that, wow, this is a team that's here to help me, they're able to relax and really let us get to know them and build that rapport, because this is a relationship building. We want to get to know patients very early in their disease process and support them throughout their cancer journey. Often get a referral for patients because it's helpful for us to coordinate with their other providers, and we want to keep everyone in the loop, including primary care providers and oncologists and other specialists. However, if you were to call without a referral, we can kind of work on that referral paperwork afterwards. So we do require a referral, but we also accept people's phone calls that just are inquiring about palliative care and get them set up. Palliative care is considered the standard of care with comprehensive cancer care and other illness. So yes, insurance covers palliative care, and that's something that our office can help with.